We're now discussing movement in the pelvic joints. And of course, movement can occur with the pelvis moving on the hip joints without concomitant movement inside the SI joint, without concomitant movement in the pubic joint. At extremes, I would expect that some of that motion will occur through those other structures. Now, a couple of degrees of rotation have been reported. In cases of hypermobility, some increase from that. But the average in many of these studies demonstrate approximately 2 millimeters of glide or less, or 2 degrees of rotation or less. And earlier studies were using x-rays and they just weren't very accurate. We know, of course, that in preparing for birth that the pubic joint widens, all ligaments soften up, and at that point movement is of course much greater. The fact that the bone can deform may explain why, when we do passive motion testing through bony landmarks, why we perceive movement through the structure, why we perceive perhaps a large amount of movement. Some of that can be in bony deformation. The other thing to realize, of course, is that when we're springing a pelvis through the ilium, we're at a distance to the joint. When we're doing a vertical spring on the ischial tuberosity, we are at a distance, okay? So we may appreciate the effect of leverage, the effect of distance, the geometry of the force, and certainly it's reasonable to believe that we cannot isolate movement only in the sacroiliac joint, only in the pube, that our best efforts are somewhat successful, but movement will also occur in proximal joints, and that might be why we perceive a greater amount of movement than what is reported in the literature. Inhibited muscles, of course, are stabilizers of the joint, and if muscle is inhibited, then we may in fact perceive greater movement. And the other thing is that the very manner in which we test movement in this structure may have to do with how much perceived movement that we experience. And there is one way of taking up the slack through a joint. Let's just say arbitrarily I'm springing the left pubic bone, and regardless of the way that it appears in terms of my positioning of my arm and hand, the direction of force that I am imparting is perpendicular to the face of the pubic bone. So if I load that structure, this is quite a pure spring test because it is right next to that joint, so that it should be fairly easy for me to perceive if I can deform that structure, and then if I can impart movement through it. Now, here's one way of doing that spring test. Another way, of course, would be to have my arm reflect the same as the direction of force, so now it looks more accurate. The line of force is perpendicular. However, we teach clinicians to set their whole body, to set themselves up to do the motion testing, so that when I now do this spring, the rest of my body is stable, yet I can feel, a slight give in my ankle, my big toe. My whole body participates in taking up the slack through the structure, even though I'm taking up the slack with only less than 5 to 10 pounds, not any more than that. So with my whole body positioned, I take up the slack, and then I impart the movement. So all these receptors throughout my entire body participate in that, as opposed to when I just stiff arm it, and then it's limited to these receptors right here. So that might be another another thing that explains that. When we discuss radiology, we'll discuss some objective measures for evaluating excessive movement in that structure. As we get into the different types of dysfunction, we'll talk about how that movement happens through that structure based on the type of dysfunction that we encounter. And there is a good coverage of motion in the workbook, one specific to the SI, and then one specific to the symphysis pubis. And I think that that's an adequate brief introduction to that. Of course, just want to remind that we also need to look at this through the lens of the whole pelvis moving in connection with the lumbar spine, with connection of the hips, and that the pelvis can move with alteration of tension in soft tissues that cause it to look like there is much greater movement occurring inside the joint than actually is. And I think that this will serve as that brief introduction. Thank you.